Hello and welcome to North Country Matters. My name is Donna Seymour. I'm a member of the St. Lawrence County branch of the American Association of University Women, one of the civic partners for this show. Today we have Andrea Montgomery, the director of the St. Lawrence County Office for the Aging, in the studio. Andrea, welcome to North Country Matters. It's wonderful to have you here. You are a newly appointed director.
Yes.
When were you appointed?
July 16th.
July 16th. So you've had a few months on the job now. According to the 2013 census figures, 15% of our population in this county is 65 or older, but you actually serve adults age 60 and over, so it's actually a larger chunk of our population. The Global Age Watch Index released on the 1st of October some statistics about older people in the world, and they cover 65 countries. Switzerland, Canada, Germany, Norway, and Sweden rank in the top 5 in terms of how well they take care of their older population. The United States ranks 8th, which is pretty good.
Not bad.
Not bad, exactly. There are about 868 million people in the world over 60, which is about 12% of the global population. And by 2050, that number is expected to rise to 2.2 billion, or 21% of the world population. So one of the things that you've been doing this fall is holding a series of meetings around the county about the proposed changes to the Older Americans Act program. And these these people have been older adults, caregivers, and beneficiaries of the program. So what are the proposals, and what have you been hearing on your listening tour?
Sure. Well, we have around 22,000 seniors living in St. Lawrence County, so it's certainly a significant number of the population that we need to think about. Basically, when we go around to our public hearings, it's a great time to meet with our seniors and really see what are the needs and services they want, what are they happy with, what aren't you happy with. And the big thing across the board, I would say, is how to stay in my home. How can I safely stay where I've always lived? Medicare questions, certainly. There's been a lot of changes in health insurance this past year. There's a lot of questions on that. Transportation, certainly in this very large county, remains a huge issue. As seniors get older, they might not have a vehicle any longer or may not be able to drive. How can I get to my medical appointments? How can I get to the grocery store? Support for caregivers. We have a lot of feedback for respite needs and things like that, because it's certainly a demanding job. Dementia services is another area. Fuel, weatherization, other home assistance programs, certainly as this time of year, that's what everyone starts thinking of, the bitter snap, cold snap in the air today, chronic disease, and then social recreational programs.
Andrew, what do you have for a budget to work with? The county provides you with a budget, and I'm sure you also probably get some state and federal funding that has to be managed through your office. So what do you have to work with for those 22,000 people that you serve?
We have a little over $2 million a year, which certainly is a good amount of money. Always we could use more, who couldn't, across the board, because as you can see, the need is pretty great. But the county is really dedicated to serving the needs of its seniors, and we haven't really had a lot of cuts this year, which has been wonderful. Our legislators really understand that the seniors have a lot that they need and that they want to help them with.
Oh, that's good. And one of the things we know in a county the size of St. Lawrence is that those distances between communities and the people who live in communities that are not well served, for example, either by a healthcare facility or by a grocery store, and there's plenty of little towns in St. Lawrence County that don't have a grocery store, that really adds up as a burden on this particular part of the population. One of the things, it doesn't look from a policy point of view at the New York State level that a lot of attention has really been paid to some of these issues that are continuing to increase statewide for our older population. Funding for services like care management and Meals on Wheels hasn't been increased in a decade. So the tax cap doesn't help, the budget issues don't help. That all puts constraints on you to meet your needs locally, and it's also affecting the population statewide without having that attention being focused on it.
Right.
So let's take a few minutes to look at some of these issues in depth. You mentioned before that seniors want to stay in their own homes.
They do.
And it's a primary issue for people as they age and they become less physically firm
Sure.
that they may need to make some modifications to their home, maybe like move a bedroom downstairs and where they've always been able to climb the stairs. And keeping people at home is a lot cheaper than putting them into any kind of a care facility. We do know that. But it also means there's a lot of ancillary services, as you mentioned, transportation and things like that, senior centers. How can you specifically help seniors who want to stay in their own home meet that goal?
Sure. Sure. Well, the first thing to do is they should just call our office. We have staff who have been in the position now for 20-some years, almost 30 years in some cases. So we have a wide breadth of knowledge. They know this county. They know the resources. So they're really your first go-to. I always say there isn't any silly question. Call our office. We can find out a way to help. Even if we can't help, we certainly can lead seniors or their family members to another resource that's available for them. Program that we run directly is our ISEP program, and that provides in-home care, lifeline, case management services to individuals who need personal care. We also have medical transportation that we run out of our department. It's provided to residents who do not have a car and don't have a way to get to their medical appointments. And the good thing to note about that is it's in county and out of county. We have a wonderful variety of volunteer drivers who just get reimbursed mileage. So they really are just donating their time for this, and they'll bring people to Cleveland Clinic, they'll bring people to Syracuse, Burlington, wherever someone needs to go, which is great.
So specialized care, transportation is not a barrier for specialized care out of the area.
Right, it is not. Well, but there still is a challenge that hasn't really been met yet in terms of people who need more ambulette type services. Certainly because we have volunteer drivers, we can't ask them to somebody who cannot get in and out of the vehicle. And so we do hear from seniors that there is a need for a more cost-effective ambulette service, because certainly if they were to contract with one of the local vendors, you're talking anywhere from $250 to maybe up to $800 a trip, and that's very cost prohibitive for the seniors.
Right. And of course, part of that is the cost that you need a specialized vehicle. You need
exactly.
You need a trained driver. You
right.
have to have
it's an
that
understandable cost.
Absolutely, but it is a barrier for folks.
Sure. So, certainly.
And you know, one of the things that we know is that we live in a county where we are underserved medically, and we certainly have big pockets of the county where there isn't a healthcare provider that's available in the community. So, and elderly citizens may have specialized healthcare needs that you are not necessarily going to be able to get from a clinic type situation. So, how are we meeting those needs now in terms of healthcare programs, and what do you think is the next step to make sure that we provide those services? I mean, where are we and where do we need to be?
Sure, to get health care.
Right,
for
those folks.
Sure. I think, again, transportation, getting people to be able to go with individuals. You know, we work with the hospitals. There's several councils that we're a part of, other nonprofits, the hospitals, and things like that, where we get together monthly and we talk about what are the needs of our seniors. One thing in particular, aging issue is dementia. Social adult day centers, you know, we can talk more about that in depth if you'd like later, but there needs to be a place for individuals suffering with dementia, for their families to bring them. It's a safe, protected environment where they can keep a lot of those cognitive abilities and have trained staff that are working with them. So that's an area that we're looking with. But
because they're not safe to be home alone during
many
the
of
day.
them are
maybe
not safe.
When a family member who is helping to provide a living space just can't physically be there.
Exactly.
So,
they oftentimes are still working themselves.
That's right.
So they need to go to work, but they're not safe alone in their environment. So what can we do for those individuals? How do we help them? They're not appropriate for a nursing home environment. They don't need that level of care yet, but certainly we need to keep them safe. So that's something for 2015. The office is definitely looking to try to see if we can find some funds or utilize some of our other funds to start a social adult day program.
Would you be looking to place those in communities so that we don't have as much of the transportation issue and expand where we are into places where they don't exist now? Is
sure.
That it? Yeah.
Yeah, that would be wonderful if we can. Obviously, there's a lot of startup cost with that. So we're thinking about possibly contracting with other local nonprofits, such as maybe St. Lawrence Nice Arc United Helpers, who already have locations and services in those areas, and seeing if they would be willing to start one of these programs as an add-on program. Because again, they have the transportation, they have the facilities, they have trained staff who certainly would need to be trained in the specific needs of someone with dementia and what services they would require. But it's not reinventing the wheel, and that's certainly, I think, in this day and age when all of our budgets have been cut and slashed, all of us getting together, meeting and saying, what can we do to help each other out? Because we all have the same goal. And we have very limited resources, so pooling them together as much as possible is what we need to do.
It's actually win-win because you're adding to the services that already exist, but you're meeting a specific need that you don't have to find a separate provider for. So that makes a lot of sense. One of the things that we know happens in all too many cases is that elderly folks end up on Medicaid because they've exhausted and depleted their personal savings and their family resources and things like that. So how big is that problem that you're seeing in terms of that, and and how does that impact? It certainly has a big impact on the county budget because counties in New York State have to be the main provider of that. Right. Although it's supposed to be a pass-through, it takes a while for the money to actually be reimbursed. So it is a big drain on county coffers, at least up front.
Oh, it is, yeah. I can't tell you, yes, I've been on the job for 3.5 months, but I'm born and raised in this county, so I certainly am well aware of the unique needs. We've heard so many stories of individuals who've, already said that they want to remain in, their home. They want to be able to access these things, but they can't. So one of the things that we're looking to do in terms of, where were we with healthcare?
Yeah, just in terms of the Medicaid and figuring out ways to help people stay
in their homes. Right. Well, and we do have counselors who help with that. We have a couple of wonderful trained counselors on staff who go through all the options with someone. But there's honestly not enough that's available. Long-term care insurance is incredibly unaffordable for people. So you really, you need to
you have to think about it way early.
You have to think about it way early, and then also it's very cost prohibitive. I mean, I know I checked into it myself, and they said you're not going to be able to afford this, and by the time you get there, that might not even be in existence. So someone has to almost deplete all of their resources before they can get in. So it's an issue that needs to be brought up on a local level, state and federal. It's not just, and it's across the board. Any conferences I've gone to, everyone's suffering that same thing of what do we do with these people? And then certainly you have spouses who say, there is a certain amount of money a spouse would be able to keep, but you have people who work so hard all their life. In order to get service, they need to get rid of all of their money. And there's just something that's so inherently wrong with that system. They should be able to keep their resources or certainly give it to their family members. We all want to provide for our kids and our grandkids and things like that, and that's the American dream. So I think governments need to be doing more to try to help people realize that dream and to be able to take care of them without having them deplete all their resources.
And one of the things that we see, unfortunately, is that poverty is generational.
Yes.
And, in those families who can maintain that set of resources that one generation has built up and pass it to the next, you stop that generational poverty from going. And now it seems like for a certain set of people, generational poverty is the only choice they have because they don't have the ability to pass on those resources. So it's a big problem nationally as well as locally. Then that, of course, that brings up the whole area of poverty. Half of all Americans haven't planned on they don't even know how much they're going to need to live into retirement, let alone having set that aside.
Absolutely.
It's really scary to think about facing old age without enough money or other kinds of resources. And it's one of those kind of things that once you fall into that trap, you never can play catch up because you have to start thinking about that way, way early if you're going to actually be able to save. And that's complicated, of course, by longevity. We're all living longer, and that's partly, of course, because of our better health care and everything else. But it certainly means that for seniors who are in that situation, they're going to need help sooner or later because if you live to 90 and you've only saved up enough resources to make it to 75, there's a 15-year problem there.
Absolutely, yep. And I think that's where accessing some of the resources, although I will say with our seniors, we find pride is a huge issue.
Yes.
It's the baby boomer generation, and we hear a lot at the office, I don't want to take a handout. What we usually say to them is, have you worked? Did you pay taxes? Then you're just getting back all of that money that you paid for 40 years.
It was a social savings account in many ways.
Right, yeah. Exactly. And that's how they need to look at it, is if now is your time to have someone help you out. So I think just being willing and open-minded to trying some of these services and realizing that it's not getting erased from that stigma that's against some of it as they get older. You don't really want to admit that you need some of those helps and those services. So like I said, calling our office, we have 8 congregate nutrition sites located throughout the county, and I think that's important for people to know. We do home-delivered meals. And
that's, again, all volunteer help, right? Who actually does a lot of the
our volunteers, yeah. Yes. We do have paid staff members as well doing the cooking and things
But in terms of the actual delivery, most of that's volunteers.
A lot of them are volunteers, although we still could always use more volunteers. I will say we get a couple really good people, but it's, a lot of them are seniors themselves, and they get to the point where they just need to rest and relax a little bit. So, we don't ever turn anyone away because of finances. We do what we can to help them. And our home-delivered meals, it's by a suggested donation. So it's $3 for a senior, $5 for anyone under age of 60. And so, it's a very reasonable cost, and that isn't based on income. We certainly have a lot of programs that are based on income, but the nutrition program is unique in terms of anyone can get a hot meal once a day, and it's a wonderful, delicious meal, and you can get a home-delivered meal, or you can come to one of our congregate sites where it's a kind of a bonus as well, because you get the socialization, you get to be with peers and things like that.
Right, and one of the things that we know in this county is there's 38 emergency food banks of some kind. Some are like in the major communities, they're part of the CDP program, and actually they are neighborhood centers, and some they may be revolved around a church or something like that. But I've had folks tell me the same thing, that sometimes the hardest group of people to serve are seniors because they don't want to come in and do that. And yet we've seen since the downturn in the economy that a lot of people have fallen out of the middle class, and they are going for help in ways that they never thought they'd have to either. So, and certainly for our seniors, they put their years in, and they shouldn't feel that. They should not feel that way at all. One of the interesting statistics that I came across in preparing for this is that in the 20 years from 1990 to 2010, the proportion of elderly people in the United States grew by more than 1,100%.
Wow.
Which is amazing when you stop and think about how big that percentage is and the kind of growth in that. But we know that as people age, they then need care of various levels and various kinds, and that the cost of providing that care is more than just paying for somebody to come into somebody's home to help them. And especially in the case where it's a family member who's providing that caregiving, they're giving up time at work, they're giving up other responsibilities that they may have in order to provide that kind of care, and that it also has a non-monetary cost. It can affect health, it can affect marriages, it can affect jobs and earning and financial reserves as you try to help people who are older. And there's, of course, a gender component as well. This has been studied that daughters provide a lot more care than their brothers do, unfortunately, in these kind of situations. How is the caregiving need being met right now in the county, and where do you see the need increasing, obviously, as the number of people increase, but where are we going to find those care providers in the future, because families are now smaller than they used to be. It's not like you have 5 or 6 siblings that can divide up these chores.
Sure, and I think that's something that they've seen through the years in the department that has changed. It was typically, I know when I was growing up, that's what your parents did. Your parents cared for your grandparents, and that is changing. You're right, and I think family numbers and jobs, people are moving out of the county because there's not as many jobs. Younger people are leaving the county, so I think that's something across the board that needs to be looked into. So we do provide caregiver respite. There are funds available. I know know there's some other wonderful nonprofit agencies in the community, such as hospice, that do supporting the caregiver. They have special workshops that really emphasize the unique needs of the caregiver, like you said, health. You know, when they look at the mortality rates of an individual who has provided in-depth care for someone for years, they oftentimes have been neglecting their own needs, their own health. They get sick. My own personal situation that happened. My father was a care provider for my mother for years and years, and he had a sudden heart attack and died. Brought me back into the area. So I'm uniquely aware of what can happen in this situation. I know that's something we're looking into in the next 2 years, really trying to bump up the services as much as we can to really help these care providers and to encourage more people to take that role. I think if there were supports and services available to them, to they know that, no, you still can go to the movies, you still can go out to dinner every now and again, go get your grocery shopping done, and you will have somebody, a group that can come in and take over for you. Knowing that that's available, I think would encourage more people to take on that role. I think there's a lot of individuals who want to, but just don't think that they're going to have the resources to do so.
Right. You know, and the other thing I think that we need to think about too are the healthcare providers who are caregivers, that is also a growing field, and yet it tends to be pretty much of a low-wage field, and it's yet physically and emotionally a very demanding job.
Very
so
much so.
how do we find those people and encourage them to go into that field and yet not make it a dead end as far as an employment field?
Sure. And I think more needs to be done, obviously, on a state and federal level with that advocacy efforts and things like that. I just attended a directors conference of all the local or statewide New York State Office for the Aging directors, and it was something that was brought up quite a bit that we talked about. We have a lobbyist that goes into Albany and certainly lobbies with the Senate and the Congress to say that these are needs. We have a severe lack of home health aides in this county, and as you said, it's one of the hardest jobs that can be done, and it's at a base level rate. You're not going to get people who are going to stay, and a lot of times there's not necessarily insurance involved, and people need to think about their families and what's best for them, and it's such a vital, important role. So I think more needs to be done to bring up the wages for these individuals, certainly health insurance, and in Messina area in particular, we have individuals who are on a waiting list for our services because there's not aides in that area, not because we don't have openings, but because we don't have the staff. The local agencies that we partner with to provide the in-home services, they just don't have anyone who can do it. So,
for example, if you want to go into childcare, there are courses you can take, there is support you can get to actually open a business as a childcare. Does that same set of services exist for caregivers, or is that a place where there's an opportunity to actually create some of these programs that would be pathways into the environment?
Sure, I think it would be a great idea if they were to do some of that. And I know some of the local colleges have looked at that in terms of the child care. SUNY Canton in particular with their early childhood education program to looking at loan forgiveness. Things like that to encourage people. I know they did it years ago in the nursing field when the need was so critical and they couldn't get nurses. They did a little bit, if you do incentives for people, make it easier for them to afford those educational programs and things like that to encourage. I think, for a lot of people, they'd love to go back to school and they'd love to learn about these things, but you have a family you need to take care of and you say, I can't afford it. I can't afford the loans. So if the government were to look into that and make it more accessible, I think you would find a lot more people be willing to do that.
So that's a message to all the policymakers out there. There's an opportunity, that's for sure.
As you're interviewing them in the coming weeks, you can bring that up.
Exactly. One of the other things I wanted to chat with you a little bit about, and we talked a little bit before about longevity, and it's affecting every aspect of our society, that, traditionally the retirement age is somewhere between 62 and 65 for people, maybe going up to about 67. But a lot of people are healthy, and they're still they want to work because they like the job that they have, or they want to work part-time as a supplement to their retirement income. So, but what they find is that a lot of times there are barriers for the older worker. There's age discrimination and things like that. So, what do you think in terms of are you seeing the seniors who want to continue to work at least part-time, are they facing those kind of barriers here in St. Lawrence County? And is there age discrimination that in the workplace that you're seeing from what you're hearing from your clients?
Sure. I think It happens. You know, I haven't, again, early on, heard a lot of stories. We have an employment program. It's very small, unfortunately only 3 slots at a time, but our client coordinator has developed such good relationships with the employers that they come looking. Even when they know we don't have, our 3 slots are filled, they call our employment coordinator to say, hey, do you know of anyone who's good? So I think there are businesses that are looking. They do recognize the wealth of experience and knowledge that is there. Sometimes I wonder with some of our seniors if it's more just the fear that they're going to be discriminated against than the actuality. I mean, certainly we know there always would be companies who wouldn't even be open to that, but a lot of the people, businesses I talk to seem very willing to give seniors an opportunity. I think the seniors just need to go take that chance, be willing to explore those options to see what would be available to them. So I think it's them taking that step. And certainly that's nerve-wracking for anyone. Applying for a job, doesn't matter what age you are, it's scary. Yeah. And an interview is scary. So I think, we have an employment program. Certainly people could get information, but then we also have several other senior employment programs that we work with that are located in the county, that if someone was interested in getting some interviewing skills, things like that, getting back into the workforce, they should give us a call and we can get them in touch with somebody who could help them kind of beef up those skills.
Well, in our last couple of minutes, Andrea, what do you have in the way of, like perhaps a manual or literature that you can hand to people that is a comprehensive list of all of the services that seniors can get? I did put your website, St. Lawrence County Office of the Aging, is up on the screen as a graphic for this show. But tell us a little bit about where somebody could maybe pick up a resource book of some kind.
Well, they can pick up information at any of our 8 nutrition sites located throughout the county, and those are, just to let people know, Messina, Potsdam, Canton, DeKalb, Edwards, Star Lake, Morristown, and Ogdensburg. So
that covers us geographically.
It really does, and they can stop in to any of these sites and get a lot of information, as well as we have a monthly newsletter that we send out called Mature Living. And that is available to be mailed to people, emailed to people. It's also available at the nutrition sites, the local hospitals, any of the enriched housing complexes. And that's nice because it's a snapshot of what's going on that month that we think you need to know about in terms of senior events, senior clubs, getting involved in your local senior club. That's also very important. And again,
that socialization piece.
That socialization piece, and realizing that I was at a health fair this morning, and I had a lot of people say, I'm not old enough for your services yet, but I could tell they were 60 and above. Realizing that 60 isn't what it was, and that they're younger, and we're trying to target those young, healthy seniors who still want to be active and still want to be involved. We are looking at starting, an arts program, so acting, dance, visual arts, things like that, as a way to be involved in your community, meet new people, things like that.
And also, plus it adds that mental stimulation that helps to stave off some of the dementia problems later on that people so often can fall into, particularly if they are living alone, still in their own home. They may not be active in their community anymore.
Right, exactly. And we have computer classes. We've started a Facebook page, so it's St. Lawrence County Office for the Aging on Facebook. And every week we're getting about 20 more likes, which is great. We're up to about 125 in the 3 months since I've been here. And I think people are starting to get some of this information so that they can just stay informed. And when in doubt, call the office. We can send you information. We can talk to you. You can meet with one of our staff members and really just review everything that's open to you.
Well, Andrea, thank you so much.
Thank you.
It is not like it used to be, is it? I mean, this is a dynamic and exciting field to be in, and there's a lot of opportunity to really have a huge positive impact on people's lives. And clearly, this is where you're headed. And I love the idea of using social media as a way to outreach to people.
Absolutely.
Because that's the same thing that we're seeing transforming younger generations. Let's use that same opportunity for our elderly population. So thank you for coming in, and I hope that you start getting those phone calls and those Facebook likes.
Thank you so much. Thanks for having me.
Thank you. These conversations are a production of North Country Matters, produced here in the studios of WCKN on the University of Clarkson College. The show is a civic collaboration between the St. Lawrence County branch of the American Association of University Women, the St. Lawrence County League of Women Voters, and the Communication and Media Department at Clarkson. Until next time, remember, our North Country matters.